Jowls are one of the most common things that people ask about online and in clinic. People will ask me, do I need a facelift, or can Botox fix this? Or what about fillers? Lasers? And is there a skincare product that can get rid of jowls? And the reason this question is so confusing is because jowls are not just caused by one thing. Jowls are not just loose skin, they're not fat, sagging, or bone loss. They are actually a combination of skin aging, collagen loss, facial fat pad shifting, mandibular bone change, ligament anatomy, and muscle pull around the lower face. So if you ask, what is the best treatment for jowls? The honest answer is, it depends on what is causing your jowls. Because if you treat the wrong component, you either get no improvement, or worse, you get that overfilled, heavy, distorted lower face that nobody wants. So in this video, I'm going to break down for you what jowls actually are and why they happen and what treatments actually make sense. By the way, if you're new here, my name is Dr. Danny Guo. I'm a cosmetic and surgical dermatologist, and on this channel, I talk about skincare, skin health, and cosmetic treatments without the hype. First, what are jowls? Jowls are the soft tissue fullness and sagging that develop along the lower jawline, usually beside the chin and in front of the angle of the jaw. When people are younger, the jawline tends to look smoother and more continuous. But with age, the lower face starts to change. The skin loses elasticity, collagen decreases, fat pads shift, bone support changes, and ligament tethers certain areas down. And the muscles around your mouth and chin can actually pull the lower face in a way that makes the jowls look more obvious. That is why jowls often show up as this little dip and bulge along the jawline. And this is really important to note because a jowl is not just extra fat hanging down. That is one of the biggest mistakes that people make when attempting to treat this. If jowls were just fat, you might assume that removing the fat or dissolving the fat right here can fix it. But if the actual problem is skin laxity, volume loss, bone loss, or ligament tethering, then removing the fat is going to make the area look worse. So let's break down the anatomy. The first component is loose skin and collagen loss. As we age, the skin loses collagen, elastin, and structural support. The skin becomes thinner, less elastic, and less able to bounce back when it's moved. This is because the skin is basically the envelope that holds the facial structures together. When that envelope becomes loose, the lower face becomes less defined. And that is why some people develop early jowling, even if they are not overweight, and even if they do not have a lot of lower face fullness. The issue is not excess volume. The issue is that the skin is no longer holding the lower face as tightly. So what can you do about this? This is where treatments like lasers, radiofrequency, ultrasound, microneedling, and skincare comes in. But let's be honest, skincare can help the quality of the skin. There's no questions about that. It can improve texture, pigmentation, hydration, and to some degree, collagen support over time. Retinoids, sunscreen, and a good barrier cream are all useful for long-term skin quality. But skincare will not lift true jowls. There is no cream that's going to pull the sagging tissue back up onto your jawline. So if someone is selling you a jaw lifting cream, that's just marketing. Energy-based devices can help because they can stimulate collagen remodeling in the deeper skin layers. Things like radiofrequency microneedling, ultrasound tightening, and certain lasers can create modest tightening in the right person. But the key word there is modest. If you have mild skin laxity, these treatments are going to help. But if you have moderate to severe jowls, they're probably not going to replicate what surgery can do. So if you're looking for a non-surgical option, this is probably where you're going to be disappointed. So for skin laxity, the hierarchy is something like this. Skincare helps maintain the skin quality. Things like sunscreen, retinoids, and vitamin C moisturizers and barrier creams can help improve texture, tone, collagen support, and overall skin health. But by themselves, they are not going to physically lift true jowls. Energy-based devices can help mild laxity, and treatments like the ones I mentioned before, Morpheus 8, Thermage, All-Therapy, Soft Wave, Clear and Brilliant, Fraxel, or even CO2 laser and Ultra Clear can improve collagen remodeling and skin tightness to some degree, but they usually give subtle tightening, not a surgical lift. And finally, surgery like face and neck lift is still the most powerful treatment for significant loose skin. The second component of this is shifting facial fat pads. This one is huge. Let's start from the beginning. The face has multiple fat compartments. When we're younger, these fat pads sit higher and create facial support. Over time, and this happens to all of us, your facial fat pads are gonna move forward and downward. When this happens in your mid-face, the fat pads can descend and cause volume loss and reduce support, thus causing a flattening of the cheek area and an increased visibility of the nasolabial fold. When the lateral cheek fat pad descends, This fat pad moves down and swings forward and gets stopped by the mandibular ligament, and therefore you create a prominence of fatty tissue right here in front of the marionette line. It's because of this connection that jowls are often connected to the fat pad movement of your cheeks, both medial and lateral. You see, people think the problem is only at the jawline, but sometimes the jawline looks worse because the support above it has changed. So what can you do about this? Well, once again, facelift can technically reposition some of those fat pads, but not everybody's ready for that. Nor is everybody necessarily a good candidate for that. But if volume loss is the main concern, then revolumizing fillers can help. But there's a huge caveat here. You need to do this correctly, but the reality is most people just don't. The goal of filler for jowls is usually not to inject directly into the jowl. If you add filler into an area that is already heavy, you can make the lower face look even heavier. Instead, filler is often used to restore support in strategic areas. This could mean the lateral cheek, the preauricular area, the piriform area, the chin, the prejowl sulcus, or the jawline, depending on the person's specific anatomy. But remember, filler is not magic. It can camouflage, it can support, it can rebalance, but it does not physically lift the tissue the same way that surgery does. And anybody claiming otherwise probably doesn't understand the concept of gravity. But when done correctly, this can still work. This is why in early jowling, filler in this area, for example, can look great. But in more advanced jowling, trying to fix this entire area with just filler can create a bulky lower face. So the question is not, can fillers treat jowls? The question should actually be, is this type of jowling where filler will improve the anatomy, or will it just add more weight? The third component is bone change. This one actually happens to all of us, but nobody really talks about it. The lower face is not just skin and fat. It is built on bone, and with age, the mandible or your jaw changes. There could be bone resorption and reduced structural support around the chin, the jawline, and the mandibular angle. When the bony foundation shrinks or changes shape, the soft tissue is going to have less support. Think of it like a tent. If the frame became smaller, the fabric becomes looser. The skin and soft tissue have to drape over a changing skeleton. This is one of the reasons that jowls can become more noticeable with age, even when a person has not gained any weight. So what can you do for bone support? This is where structural filler can be useful. Filler placed in the chin, the prejowl sulcus, the mandibular angle, or the jawline can help recreate some of the lost structural support and improve the transition along the jawline. But again, it has to be done correctly. If you do it right and subtly, it's gonna look really nice. But if you do it incorrectly, you might look like you're drawing a cartoon. In some people, especially if you have significant bone loss or more advanced aging, filler is going to have its limitations. Look, it can improve contour, but it does not truly replace bone, and it cannot lift everything back into place. In those cases, surgery or implants may be more appropriate, but I'm not the expert. I would speak with a plastic surgeon who knows this topic better. The fourth component is the mandibular ligament. This is the reason that jowls have that specific funny shape. The mandibular ligament is a retaining ligament along the jawline. Retaining ligaments hold certain tissues in place. As surrounding tissue, like the tissue behind it, descends with age, this ligament is going to act like a fixed point and hold everything up. So you get this tissue sag around the tethered area, creating a visible bulge and a dip. This is why you can get that prejowl sulcus, which is the indentation just in front of the jowl. This means that the jowl is not just an issue of fat pad descent. It's that it is descending in relation to fixed ligamentous attachments. This is why the jawline can look irregular instead of simply the whole thing coming down. So what can you do about this ligament component? The reality is not that much, but a little bit of contouring filler in this area can be used to camouflage the prejowl sulcus. If you have a hollowing or an indentation in front of this jowl, putting a little bit of a soft filler in that area can smoothen the transition from the jowl to your chin. The fifth component is muscle pull, especially the DAO. The DAO stands for depressor anguli oris. It's this triangular muscle right here that pulls the corner of your mouth down. When this muscle is overactive, it can contribute to a downward turned mouth, marionette line, and a more negative facial appearance. This is also known as a resting frown. This muscle does not create the jowls by itself, but it can make the lower face look heavier and accentuate the appearance of the jowls. Fortunately, we have a great solution for this: botulinum toxin. When your dermatologist puts a little bit of Botox or botulinum toxin into the DAO, it can help relax some of the downward pull, allowing the corners of the mouth to sit a little bit more neutrally. But this does not work for everyone. A quick and easy way to test whether you're a good candidate for this at home is to literally just take your finger, put it right on top of that muscle there, and just push up a little bit. If the angle of the mouth neutralizes, then perhaps you're a good candidate. But if it doesn't, it's probably because there's a little bit of extra tissue above that fold that's folding over it. Now that is a volume issue and not necessarily a muscle activity issue. Okay, so now we've talked a lot about the different causes and potential treatments for jowls. And the reason I wanted to make this video is because a lot of people are asking me this exact question, both online on social media, as well as in person in clinic. It's a topic that obviously a lot of people care about, so I kind of wanted to make this summary so that everything is put together in one place. But another point I want to put out there is that for some people, there's no jowl. This is just normal anatomy. You see, the internet has made everyone stare at their lower face under the worst possible angles. You got your front camera, you got your harsh lighting right in front of you, the camera's like 12 inches away, you got your chin tucked down. Of course, if you look at yourself like that, your jawline's gonna fold a little bit. Your skin moves, your face moves. We are not sculpted statues, and not every shadow or fold is going to need treatment. So before you panic and go get all of these treatments that I talked about today, go and look at your face in a more normal way first. Have a neutral expression, okay? Normal room lighting. Have your camera at arm's length distance, and then ask yourself, is this actually something that bothers you? Or is it just something that the internet has taught you to notice? But if jowls genuinely bother you, the key is to identify the cause, right? Loose skin is treated differently from volume loss, which is different from fat descent, or bone loss, or muscle pull. So if there is one thing I want you to take away from this video, is that jowls are not just one problem. It's the visible result of multiple aging pathways happening all at the same time. And that is why there is no single best treatment for everyone. The right treatment depends on your specific anatomy. Guys, if you found this video helpful, please let me know in the comments. I'd love to hear your feedback. And of course, if you have any videos that you want me to cover specifically on the topics that I touched on today, let me know. And as always, like and subscribe if you want more evidence-based skincare and dermatology content.